This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about when you should get an MRI. If you like this video, we put out new content weekly, so please like and subscribe. So MRI is really good for seeing soft tissues. So it's good for seeing ligaments, it's good for seeing tendons, it's good for seeing fluid. It can also detect like tumors and anything like that. So that's generally when we tend to use it. If it's just bones, then X-ray usually does really good. If it's like really subtle bone fractures, then you can either do CT scan or MRI. If it's the foot, usually I'll get a CT scan, but MRI sometimes will show stress fractures as well, which CT scans might not. But anyways, for most people, when you should get an MRI, basically when you have some sort of injury of your arm, and look, I'm just talking about extremity MRIs or spine MRIs, not like MRIs for your abdomen, because that's sort of out of my area of expertise. But like, let's say you have knee pain and the x-rays don't show a lot and you've got some like really something funky going on and it's not getting better with like physical therapy or an injection, that's generally when you would get an MRI. And that sort of applies, that's the algorithm that most people use in most parts of the body. So again, pain, conservative care is not working, then you end up getting the MRI. There's other instances where you'll just jump right to the MRI, like if you get in an accident and it looks like your ACL is torn, we can go right to an MRI. If you have something in your rotator cuff, it seems like it's just torn and you can't lift your arm up, that can look for an MRI. But again, MRIs are good for soft tissues. So they do see bones, but you're really looking at any sort of, like I said, ligament, tendon, you can even see some nerves and all that sort of stuff. And that's what it's good for. But again, if you just have like a bony sort of pain, like let's say for the hand, I think a lot of times the x-rays are more useful than MRI, especially when you start getting out into fingers. The MRI is not super useful. X-rays are usually much better at for diagnostic purposes, and sometimes you might need both. It just depends what you've got going on. So again, just to sum it up, when to get an MRI, when you have a soft tissue injury, normally that's not gotten better to conservative management, which means time, rest, anti-inflammatories, physical therapy, possibly an injection, or if it's just something feels unstable or doesn't quite feel right, then it might be worth to jump right to the MRI. So I hope I was able to answer your questions about when you should get an MRI. If you have any questions I didn't answer, feel free to leave them in the comments below, but I can't give you any advice about your personal condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.